Hi, everybody. It's Dr. Christine Anderson here. I'm coming to you live on a new platform. And so I'm streaming both to YouTube and my Facebook channel at the same time. So I hope all goes well with this. I am just kind of playing around. So if you do join me, you are able to chat. I'm here tonight to talk about foot and ankle health, optimal health for your feet and ankles. So yeah, we've been doing a whole series going down the spine with posture. We did the upper extremities. Now we're at the bottom of the lower extremities. And if you are so inclined to subscribe to my Dr. Christine Anderson Chiropractor YouTube channel, when I put up exercises that I talk about during the broadcast, then you're going to get notified when they go up. And I do plan on putting some up this week. So go ahead and subscribe now. Just click that button and then you won't miss anything when I go live. All right. So I am going to just crack on here and just talk about the feet and the ankles, as they are the foundation for our whole body. So problems with your feet are like having a sinking or uneven foundation in your home. And it's a chain reaction that can go all the way up what we call the kinetic chain. So this is the proverbial, your foot bone's connected to your ankle bone, connected to your knee bone, that type of thing, right? And if your feet are painful, it's really not fun because we have to walk to get around, right? So if we can't walk, we have to use things like crutches, and that's no fun. So we want to make sure our feet are super happy. So I'm going to dive right in and talk about sort of the structure of the foot. And I've got a handy dandy little skeleton here, and he's got a little foot going on right there. So I'm going to use that, and I've actually got some diagrams. So we have 3 arches to our feet. So most of us think of just that middle arch that, we talk about, oh, you have a fallen arch, or you have a flat feet or a high arch, right? So we tend to think of just that middle one, but we actually have 3 arches. And of course, whenever I'm looking for a picture, I'm not finding it right off. So what's that mean? I'm not supposed to show you arches. So we've got that center arch. We've got the side arch at the side of our foot. There it is. So this is a normal foot right here. And there is the middle arch right here. Here's the side arch. And then there's the arch across the top of the foot. That's called the transverse arch. And what I am showing you right now, this is actually a foot scan. I have a device in my office. It's actually a pretty sophisticated piece of equipment because it actually scans your feet in 3D. So I can see what's going on with your arches, where the weight is on your feet, where the weight is on each side, and the difference in the arch between the 2 feet, which gives me a lot of information about what's going on with your foundation. Okay, so this is the proverbial flat foot. So just no arches. That red is where the weight is. So this is optimal right here. And this arch is totally fallen down. So I started talking about flat feet. And this is where we totally lose that structure and foundation of the foot. That means you're going to have too much contact with the ground, and you're not going to have that nice arch. There's going to be less shock absorption. It's going to be less stable as a foundation. And it can cause problems all the way up that chain, as I said. When you drop this arch, so we call it pronation, when that foot gets too flat and drops, what can tend to happen, this is a great illustration, is that the arch drops in the center, the knee goes with it, the hip drops down, the shoulders become uneven, and even the head can become imbalanced. So that's that whole chain that I talk about that also can create asymmetries in the weight. So what are some risk factors of this flat foot? It could be you're overweight. It could be you have diabetes. It could be just stress over time with walking and standing and gravity. It could be pregnancy, which loosens the ligaments, trauma to your feet, like sprains or strains or fractures, or even there is a component, I believe, of heredity, because I have really good arches, but my sons did not. And they tended to follow more in their father's footsteps of having flat feet. So speaking of that, babies are actually born with flat feet, and they develop their arches when they start becoming weight-bearing and walking. So that's why it's so important to have babies barefoot as much as possible, because we want them to have that full contact of the foot on the ground. There's that proprioceptive sense of the feet knowing where the brain is and the brain knowing where the feet is, and that feeling of the feet, so they can really develop those arches well. And there is an aspect too of that walking where they have to integrate a primitive reflex called the Babinski reflex. Otherwise, they're not going to walk with that foot flat on the ground. They're going to want to walk on their toes, or they may not want to walk at all, or they may have some sort of weird gait. So I am not a big proponent of like shoes with good arch support or ankle support. You actually want to get shoes that are really, really flexible so that they can move through that motion of gait, which is your foot strikes on the heel, you roll through and you push off through your toes. All right, that is supposed to be the motion of the foot. So I'm looking at this when patients come in to make sure their feet aren't out, their feet aren't in, they're not slapping their foot, they're not shuffling their feet. There's a whole sort of a bunch of things that can happen with gait. So with this foot scan, like I said, it's assessing those three arches, how you're distributing your weight, and that whole foundation. And based on that scan, I can have custom orthotics made for that person based on whatever that scan is. And I'll just show you what it kind of looks like. So this is one pair. This is for kids. They're very flexible. Okay, they're not rigid. I see a lot of orthotics out there that have a plastic kind of cup to them, and it's really plastic where they want to try to push that arch into place. And that's giving a false sense of pushing it up. You don't really want to do that. You want the brain to create that sense of foundation and balance and creating that arch. So it's more of a proprioceptive aspect with these type of orthotics that are functional, being supportive, but not rigid. So I much prefer them. They are way more comfortable, and they're tailored to each person so that it's going to affect that kinetic chain all the way up. And it's not just generic inserts that go in the shoe, where oftentimes all they're doing is they're worried about this middle arch, and they're not worried about this side lateral arch and transverse arch. So these can be a great investment, especially for holding adjustments for chiropractic patients, because if I adjust the spine and then there are things going on with the feet and the foundation, and you get up from the adjusting table and start walking around, you can pull things out of place so much easier. So I don't give these to everybody, but it's based on what I'm seeing on physical exam, what they're coming in for, and then what I'm seeing on the scan that I'm doing for orthotics. And for some people, they are vital, and others, they might just be recommended. So this isn't just a sort of one size fits all program. So this is going to go towards helping with a variety of issues up up the chain of the spine, like I said. And, you know, you kind of get what you pay for. Relatively, these are inexpensive when you look at the breakdown of maybe costing 50 cents a day for a couple of years. And if they're really supportive and there's something you're using every day, then they can be super helpful for your health. And just a little note here, okay, because my boys wore orthotics in their shoes every single day. I'm trying to think when they first got them. I want to say it was maybe around 7 years or 8 years. And here's the thing with boys. They are notorious for A, not doing something that they're supposed to do, and B, for losing things. And that did not happen with the orthotics. They wore them every single day. They didn't lose them. And they also told me when they needed new orthotics. And this is just unheard of in kids, by the way. So I think they really noticed a difference. All right, let's go to some of the issues that you might see. So number one, sprained ankle. I've experienced it. I don't know anybody who hasn't, right? And what this is, it is usually an inversion or supination of the ankle. And what I mean by that is your foot turns in. And so it's kind of like, okay, if this is your feet, right? They go in this way. So it's the outer part of the foot, that pinky side, that gets affected. And usually it's a sprain, which is the ligaments being affected. And those are the things that help hold your ankle bones and your foot bones together. And I have a little picture here. This is actually the side view of an ankle/foot. Here are the ligaments that get disrupted. And this bone here often gets disrupted too, gets pushed kind of out of place as the ankle turns on this side. So there's different grades of sprains. I'm not going to go into that, but obviously if you have more of a tear aspect, it's going to be more of a serious condition that you might need a stronger bracing effect or stay off of it for longer. But basically there's also those tarsal bones, which are the foot bones that go out of place. So a lot of times I'm doing adjustments with a sprained ankle, and that can really go a long way towards healing, because if you make sure those bones are in place, the ligaments are going to be able to heal much better. You can use bracing. I do recommend motion right after your sprain, where you can just trace the alphabet with your foot, big letters, right? And small letters. So pretend like this is the foot and you're doing it, just sitting there, getting some motion into that ankle. It sends those signals up to the brain to heal. I like to sometimes use homeopathic remedies that help with bruising and soreness and pain, like arnica. I like to use some essential oils sometimes, like lemongrass. That's super helpful for ligaments and things like that. And I'll put a link to the essential oils post I did for ligaments in the description. And in the end here, this is very important, is after you heal and you can weight bear, you have to retrain your proprioception. So when you disrupt that ligament, you disrupt the feedback to and from the brain. And therefore, this is why people say, oh, my ankle is weak, I keep spraining it. Well, your ankle isn't weak, but what is going on is that your brain doesn't really know you have an ankle. So you have to retrain it by doing exercises to be able to tell your brain that you actually have a foot, so that you will not keep injuring it. So that's super important. All right, let's move on to the plantar fasciitis. So the plantar fascia is this area here that's underneath the foot. So you can see there's actually the arch that's created right underneath. And it's that tough, fibrous band underneath your foot that can be quite sore. So this affects about 2 million Americans. And over the years, like I said, the arches can start to drop with gravity, especially if you're standing on your feet all day, like I am. So there's this tipping point that can happen, especially if you're not taking care to prevent it. So this is what the treatment I actually advise is prevention, is that fascia starts getting pulled tighter and tighter and tighter. And I do have a picture here somewhere. I will try to get out too many pictures. See, sometimes I don't have enough, and other times I have too many. Here it is. So there's the fascia under the foot. Okay. That weight part is the fascia. It can get super tough, and it can pull right on the heel here, the calcaneus. So this heel bone here is where people often feel pain. Sometimes they'll even get a bone spur built up there where the fascia is attached. And that's really sort of an effect of plantar fasciitis, not necessarily on its own, although you can have a heel spur and not feel pain in the bottom of the foot. Anyway, typically, if this is an issue, you're going to wake up with pain in the bottom of your feet, especially during those first few steps. It's kind of like that fascia isn't warmed up and it's super tight, and you go to step into it and it's like, I'm stretching. It can also occur after you stand a long time or do things like running where you're irritating the heck out of it. It can happen if you have poor posture or a weird gait. And being overweight is, again, going to put stress and tension on your feet, trying to hold your body up, right? So you've got more weight on that fascia there. Okay, so what do you want to do? Number one, you want to get off your feet as much as possible first to let it calm down. You want to make sure you stretch your calves out, because look, the calf attaches to that calcaneus and ultimately the fascia here. So if this is tight, it's going to pull on the fascia. So you want to make sure that you're doing some calf stretching, which I will come on and show you. You want to do a fascia release. So as a chiropractor, I can get in here with a tool. I have actually a couple of tools where I get in here on this fascia and I dig in there. I don't spend a lot of time digging in there, but it's painful, but it's super helpful. It can release so much tension. You can use a golf ball when you're sitting, doing anything, computer, TV. You can roll your foot on a golf ball. Orthotics are extremely helpful in this case. Icing, if it's inflamed or if you've just done some exercise, icing afterwards. Of course, I'm going to look at the foot and make sure that it's well adjusted, to make sure the bones are all in alignment. We can use kinesio tape along the bottom of the foot, the heel, the lower leg. And there's also something called shockwave therapy, which I've talked about with the hips before, that has really been shown to be quite effective on the fascia of the feet. I have had it done when I've had some stuff done on my hips. Yeah, I definitely felt it. So with the next thing we'll talk about, it kind of ties in, is Achilles tendonitis. So that's where your tendon, or the attachment of the Achilles, which is right here, this all gets inflamed. And here, right there, that red part is your calf muscle. So this can happen from overuse, and it can be mild pain. It can be stiffness. It's usually better after you warm up. It's usually worse when you're kind of cold going into it. And again, things like rest and ice after use. To me, I use natural remedies to help calm the inflammation down. Some supportive devices and maybe bandages for the muscle and tendon, kinesio tape, stretching for sure of the Achilles, massage, right? Getting in there. And sometimes ultrasound or something like that can be useful. All right. So I'm going to talk about Severs, which is a problem that occurs with the growth plate of the calcaneus. So we just talked about that. That's this bone right here. Okay, that's the calcaneus, and the growth plate is right there, right where the Achilles tendon attaches and the fascia attaches. So this is usually a problem that occurs in kids during their growth spurt phase, which might be like 9 to 14 years old. So it's a self-limiting thing because it's pulling on that growth plate. So once that growth plate fuses, it stops. But while it's happening, it can be super painful. And I do have a young patient who has had this. He still has it. We're still working with it, but it's so much better since we've been working together. And a lot of the things I've already talked about for plantar fasciitis and Achilles, you're going to be doing in this case as well. So if a child is very athletic and they're doing things like running or jumping, playing soccer, they might be running on a basketball court, they might be doing track or gymnastics, something like that, and they have pain in the heel or the bottom of the foot, think it may be Severs. So symptoms are usually worse with the activity. They get better with rest. And the treatment, again, I'm going to adjust the foot. I'm going to give them some orthotics to wear. I may use a heel cup with the orthotic. It really just depends. I'm going to work on that fascia. I'm going to give them stretching exercises for the Achilles and for the fascia on the bottom of the foot. I'm going to give you that one too. I think I'll do a fascia challenge for the foot. They may wear some sort of wrap on their foot and ankle during a sport just for some support. Ice after their whatever they're doing, and then some essential oils can be super helpful. All right, we are to bunions. Now, anybody not know what a bunion is? We know that it's no fun and it's really unsightly, and most of the time people don't like it, and it can even be very, very painful. So this is what a bunion looks like. It's that deformity. This is the big toe right there, where it kind of angles out to the side. And there can be many causes to it, like flat feet, misalignments of the feet, it can be arthritis. It can even be hereditary, but we mostly see this in women because of the type of shoes they wear, like high heels and shoes that smush the toes together. But I do see this in men as well because they can wear toe smushy shoes as well, right? And it's generally going to occur later on in life when you really kind of force that toe into that position. I can adjust that toe if it hasn't gone too far to try and help with the alignment, but you've got to stop wearing shoes that smush your toes. And if it goes too far, you know that they're going to want to do some sort of surgery. But orthotics, again, can help with the support of the whole foot. All right, we're back to the ankle with Tarsal Tunnel Syndrome. And with tarsal tunnel, this is similar. We've heard of carpal tunnel, right? And what this is that I think I'm going to grab my little skeleton guy here. So tarsal tunnel, I got to grab a leg here. Woo! We're on the big toe side. This is the ankle of the toe. This is actually where the inner ankle is, and there's ligaments right in here. So you know how on the outer side there were ligaments that we would sprain? Well, these ligaments on the inside contain a blood vessel, the blood vessels, and a nerve that gets trapped under that ligament and create problems like you'll get like a pins and needles effect or a sharp stabbing pain. It can just feel really bad, just achy all the time. And this can occur from severely flat feet because you're going to stretch the nerve as you stretch that foot out on the bottom. There can be some growths, there can be varicose veins, there can be compression on the nerve from that ligament, there can be inflammation from arthritis, injuries like an ankle sprain can aggravate it, or things like diabetes, which make that nerve more vulnerable to compression. So this is just to be aware of if you've got sort of that inner ankle pain, or it's traveling and it feels really sharp down to the bottom of your foot. This might be happening. So again, similar, you're going to rest it, maybe ice it, maybe compress it. I'm going to look at adjusting it, maybe some orthotics, and then I might look for some of these underlying conditions if I think that's an issue. All right, so I talk a lot about subluxations, which are when those foot bones go out of place, and there's a lot of them, right? There's all the phalanges, which are the toes. There's the metatarsals, which is in the foot. There's the tarsal bones, which there's 8 of them. Then there's the calcaneus that connects to the talus, which is in the ankle. All these things can go out of place. And sometimes they can just do it spontaneously. One other aspect is the diabetic foot. So if you have numbness or tingling, and that may be an issue, you want to get your vibration test, that vibratory sense test, especially on the big toe, to see if maybe your blood sugar is an issue. All right, the type of shoe does matter, guys. So you want to get, first of all, a shoe that fits you and isn't compressing your foot. I like things that are more flexible, definitely with some support, preferably from my custom-made orthotics. I don't want to have toes that push my foot in. And if you're going to get flip-flops, so these are actually flip-flops with an orthotic built into it, because orthotics are some of the worst things for your feet in general, just the way you have to hold on to them while you're walking to be able to not lose your shoe. All right, I did it. Not quite half an hour. So I hope you enjoyed this. If you have any questions, you can certainly contact me. The information will be in the description. If you like what I said, give me a thumbs up. Please subscribe to my channel, and of course, share this with your friends so they too can have optimal health and an optimal life. Until next Tuesday, when I think I'm going to actually go back. I'm actually not sure, but I may just make sure I've done the whole entire skeleton, but soon I'm going to go into the neurologic system. All right. Have a good week. I will see you next Tuesday. Bye.